Hello and welcome to Neuropathy Relief Centers, where neuropathy patients come to finally get lasting relief. In this 9-minute video, I'm going to explain to you what neuropathy is, how it affects your nerves and your quality of life, and then I will explain how our patients get better, get relief, and get their lives back. Our objective when we are dealing with patients with neuropathy is to repair your nerves, regrow your nerves, and regain your function to achieve relief and a better, happier, more fulfilling life. I know that may sound like a fantasy to some people, but by the time we finish this video, it will become perfectly clear that yes, we can help. What exactly does peripheral neuropathy mean? Neuropathy is a medical term to describe nerve damage. It means that there is nerve damage. Nerves are actually lost, meaning they are decayed or they are damaged. That is unfortunate because nerves control every function of your body and mind. The nervous system consists of the brain and the spinal cord, which is protected by the skull and spinal column. That is what's called the central nervous system, and this is where all the nerves come off. Anything outside the spine or the skull is described as the peripheral nervous system. As you can see, the nerves travel from the brain and spinal cord out to every cell in your body. It's important to note that the further away from the brain the nerves go, the smaller they become. These are the nerves that we are dealing with, and they are very small, microscopic by the time they get to your feet. There are about 150,000 free nerve endings for every inch of skin in your feet and toes, your fingers and hands. And all those peripheral nerves, the large, the small, and even the microscopic nerves, they're all connected back to the brain. It still means that the brain and the toes are still connected. Those are the large fibers, and there are even smaller ones, and then there's microscopic. So when we have large, small, microscopic nerves, these are all one single cell. You have to realize that the nerve that goes from the back to the tip of your toes, 30-some inches long, is a single cell, finer than a human hair. There's tens of thousands of them for every millimeter of skin, and they're so small and delicate that they're very easily damaged. And this damage is called peripheral neuropathy. So when anything goes wrong in the body, the first place those nerves are going to have problems is the tips of the toes in these fine microscopic nerves. At this early stage, that nerve damage of neuropathy is not even noticeable to the average patient. Because in most cases, it's blood circulation and then microcirculation that is affected in the early phase of nerve damage. Because you have blood that runs the nerves and the nerves run the blood, when you develop neuropathy, it's the smallest nerves that have a problem. If you don't get enough circulation to the nerves tend to die faster. Then you don't have enough nerves to regulate the microcirculation, and the cycle continues downward. When you look at this video, we see the skin of the legs, and then we actually look deeper into those larger nerves that run sensation and even muscles. Okay? When we look at this video, we see the skin of the legs and then actually look deeper into those larger nerves that run sensation, even muscles. You can see you have nerves there to run every function. If anything affects the blood, it's going to affect the nerves. There can be toxins, chemicals, drugs, diabetes, poor circulation, and that's what happens when you have neuropathy. A medical procedure to diagnose neuropathy is to take a piece of skin in the leg and foot and actually look at it and count those tiny microscopic nerves. These smallest nerves, the most delicate, fragile nerves. These microscopic nerves in the skin of the foot, you have about 150,000 nerves, and you can count them and see how many nerves there are. This example here would be a normal microscopic nerves in the foot. You can see that large number of them that are needed to function in the skin in that small tissue. Uh, that's pretty much the worst kind of neuropathy is painless. So as you lose these nerves, you won't feel anything because they're running function. And that's pretty much painless. And they're the worst kind of neuropathy because they pass through this whole stage with no pain. Then one day they can't walk. Other times they can be swollen and inflamed and become hypersensitive. So they feel they're basically pain fibers that are damaged. They're swollen and inflamed. Sometimes these nerves die like dry needles on a Christmas tree. They just fall off and you don't know it. So if these are less nerves, that's neuropathy. Okay, the key point to know, on the left you can see the normal number of small microscopic nerves. You can see those fine little nerves come up all the way to the skin. They go from the brain all the way to the tips of your toes, and that's a long way. Looking at the right image, when you have neuropathy, you see there are very few nerves left in the skin. The reality of it is, when you have neuropathy and nerve damage, you have less nerves. In some cases, no nerves. Neuropathy means nerve damage, and a nerve that is damaged doesn't work well. So it's either going to work too much or too little, but it's not going to be normal. And you can see the difference between nerves and no nerves. Here's a graphic of the complex functions that take place at the surface of the skin. Some of the functions are for the skin are sweat, microcirculation, and all the metabolic processes. If you have no nerves, you will lose those functions, and again, it is painless. This is an illustration, a simplified chart of the nerves that you can see. Moving from the right to the left, you can see the red microscopic nerves are fine, small nerves. Then there's the smaller nerves and the larger nerves as we move to the left into the oranges section. Each one of these nerves has a function. And all those nerves are divided by their functions. Neuropathy is a progressive disease. And as you lose these nerves, you usually start from the pointed, smallest tiny nerves in your foot, and then you're going to have deeper into the smaller nerves that have certain functions and the larger nerves. Okay? All the way as it passes to the left. It starts over in the smallest nerves, the fine microscopic that we looked at earlier, and then it keeps moving to the left. So the worst cases pass through this whole phase with no pain, but some patients will have pain, or burning pain, or pricking pain, and then there may be balance trouble or even fall. So we will check all these nerves when we do your analysis. So neuropathy is about nerve damage. And the simplest way to look at neuropathy is to look at our logo, which is the dandelion. Okay? You can see the large fibers would be the stalk, the smaller fibers would be the ones that come out of the dandelion, and the smallest ones would be these fine little hairs that are on the outside. So neuropathy is a progressive disease. You can imagine it like this dandelion losing its petals. What happens is if you have progressive neuropathy, these nerves are going away. They're just not being replaced. Or to put it another way, you are losing nerves faster than you are regrowing them. That is neuropathy. That is nerve loss. So again, the large fibers, the small fibers, and the microscopic fibers. As you lose these nerves, you'll lose this function. Where are you in this process? This is where people may develop the first symptoms of neuropathy when there's a considerable amount of loss. This is why we score the severity of your neuropathy, because neuropathy is a progressive disease. You have to determine today the severity of your nerve damage. Neuropathy is a progressive neurodegenerative disease. When it gets to this level of loss, extreme in our scoring system, well, even an ordinary doctor may be able to detect it, but the nerves may be too far gone. Neuropathy is a progressive disease, and it starts in the longest and smallest nerves, fragile nerves in your body, and those are the nerves in your toes. By the time that nerve damage spreads up to the ankle, the neuropathy starts in the next and longest and smallest nerves, and those are the nerves in your hands, as illustrated by this picture. Even if patients may not notice this slow, progressive process, our exam will determine if in fact it has progressed into the fingers and the hands. This is again the chart of the nerves, and all the nerves are separated by size but also by function. Only a small number of those nerves are used for pain or pain transmission. Okay. So we're going to check all these nerves to see what's happening. When you lose the small microscopic nerves, you're going to lose sweat and microcirculation. What does that mean? As a result of nerve damage to the microscopic nerves, you lose that function. These nerves control the microcirculation in the sweat and other various metabolic processes. These are actual patients in our office with neuropathy that demonstrate the purple, puffy, dry, cracked, swollen feet of patients with microscopic neuropathy. You can see at the underside of the feet the damage in the microcirculation. This is a patient that has not worn shoes for 3 years. Okay? You can see that these foot has neuropathy. See another foot. At the same time, when you get that swelling, you don't have good function of the vasculature, and the capillaries are not dilating. This is neuropathy. As an example, when you talk about losing a nerve, you're going to lose the blood and the microcirculation. This is actual circulation to the nerves. And you'll see anything that inhibits the circulation or stops the circulation, you're going to not have circulation to the nerve. The nerve controls the blood vessels control the nerves, and downward the cycle goes. When you look at this chart, you will see that the next fibers that are involved are the small fibers that transmit sensory information such as cold, hot, pricking, or burning. This is where, when the nerves are damaged, the patients have symptoms. When you have peripheral neuropathy, we know that the feet and toes usually feel the first problem, and they feel bad. And sometimes the patients will even have pain. It can be the pricking type of pain. You can have burning type of pain. You can have long-standing cases of nerve damage will have constant burning pain up to 100% of the time. And again, neuropathy is a progressive disease, and it starts in the tips of the toes. And the nerve damage continues and progresses. It will go up the ankle, up to the calf, and at the same time it starts in the tips of the fingers and works its way into the hands. So you don't always have to have pain. Patients may not even notice the damage in their hands. But since neuropathy is a progressive disease, this is where patients with pain will end up. Remember that the worst ones pass through this whole process without pain. Some of them will get different symptoms like restless leg syndrome. This is an urge to move your legs. Remember, when damaged nerves are sending less signals or extra signals, the nervous system has problems. But they will not be signaling normal signals. That's neuropathy. As the nerve damage progresses further to the larger fibers, the strong fibers will also be damaged, and you will lose your vibration, touch. This will be the numb foot, the balance trouble. And as it continues to affect the larger nerves, your strength, your reflexes, and your weaknesses will be developed, and you will be at fault. So patients will tell me that maybe they have a numb, dead feeling in their foot, like they're walking on cardboard or a tight piece of tape. Balance troubles will develop when you have that numb foot and when those large fibers are damaged. You will have difficulty navigating. You will have to hold on to things, use your cane, or have help from people because you can't feel your feet and your feet can't feel the ground. This lack of stability is scary. You may be forced to use a cane, using your hands to stabilize you by touching the ground with a stick because you've lost the nerves in the feet and you cannot feel the ground correctly. And then as it progresses, the more problems you will have with falls. Neuropathy is a true risk factor with falls. And nobody says, oh, I'm going to have a fall today. I'm going to try to be careful. But if you can't feel your feet, you'll have balance troubles and falls. And this is what we see with our patients with advanced neuropathy. In fact, patients with neuropathy should not even climb stairs because they lack the strength and sensation to navigate properly. Falls are the leading cause of death from injury in patients over 65 years of age. The leading cause of death and disability in people over 75 years of age. And falls as a percentage of home accidents has been increasing as the progression of neuropathy has been increasing. Patients with progressive neuropathy don't get their proper exercise and their cardiovascular health suffers. Neuropathy progresses, you lose the muscles, and your ability to walk is reduced because your daily activity is reduced, your walking capacity is reduced. Many patients do not achieve their recommended daily activity, and they continue to have reduced mobility and cardiovascular health. You cannot do the things you enjoy with the people you enjoy doing them with. And the progression of neuropathy will rob you of your quality of life the further it progresses. When we talk about the outcomes of neuropathy, one of the most feared problems of neuropathy is amputation. It's probably the highest risk factor for amputation because you don't have the metabolic process to keep the tissue healthy. You don't have the proper circulation, you don't have the proper microcirculation, and the tissue is at risk. But the damaged parts of the nervous system are affecting your healthy parts, and everything starts to compensate the wrong way. That's why we talk about peripheral neuropathy affecting your brain and your emotions. Since neuropathy is progressive disease, this is where patients in pain end up. Some of the patients will have pain, tingling, burning feet and toes, cramping, restless legs, numb toes, difficulty walking, and balance problems. At this point, we have to talk about how we're going to treat your neuropathy. Since neuropathy is a progressive neurodegenerative disease, first, we must slow this process down. Stop the nerves from being worse damaged. That is considered a medical miracle because no one else is offering that to you. Once we accomplish this, we will continue to repair the damage, regrow these nerves, and regain our function. We have created a program that repairs the damage, regrows those nerves and blood vessels, and allows you to regain your senses and normal function. If the nerve gets better, you get better. And this is how we do it. We use space-age technology to combat this chronic disease. This stuff is studied by NASA to help the tissue and the nerves work better. One of the ways that we do this is with light therapy. But I wanted to show you the light therapy, putting it right where the problem is, in your toes, in your feet, in your legs, even in your hands. In fact, that's where the problem is, and the whole point is to do everything we can to make the nerves work better. That's our job. This is using modern technology to combat this chronic disease. We put the problem right where the problem is, right where the nerves are. You can see the diodes. I'm going to show you this video. These lasers or light therapy are specifically designed to put the problem at rest. There are specific frequencies and wavelengths that are able to penetrate deep into the tissue where those nerves are damaged and increase the circulation, reduce the nerve inflammation, and allow those nerves to work better. That's just one of the things that we do. As another example, you can see the light therapy, the laser being put over a part of the hand. And you can see that it passes into the tissue deep, increases the circulation, and allows the microcirculation to grow back, to go in and help those nerves work better. Again, in the finger, increasing the light therapy increases circulation, and microcirculation reduces the inflammation and allows those nerves to work better. Specifically, when we view the tissue of the skin, the interaction of the light as it penetrates deep into that tissue is able to contact those damaged nerves and actually regrow new blood vessels and help the nerves work better. So in this case, you have nerves on the left, and the nerves that aren't there anymore on the right. So you can be like other patients who tell me that they have burning pain and they have tingling pain or they have cold feet, yet when we do their exam, they actually won't feel anything because they don't have the nerves there. And that's the problem with neuropathy, is the bad nerves sending a bad signal all the time. And it's all one nervous system. So the nervous system, the central nervous system in the brain, start to have problems that give you these chronic conditions. This is one of the ways that this works, but because we help the nerves work better with the microcirculation. If you look at the top left, you can see a laser Doppler image of the microcirculation of the knee. The same in the upper right-hand corner with the ankle. We put the light pads on this patient for 20 minutes, right there where the problem is, and you can see a massive increase in circulation after just 20 minutes of care. All the way down to the heel, all the way down to the knee. That's how it works, by increasing the microcirculation. Okay? After just one 20-minute therapy. When you do it on the feet, same thing. This is the foot on the left before the therapy. On the right, you can see the left foot has a massive increase in circulation that will last for up to 4 hours. It's not just warm, it's better function. So you remember that purple feet that I showed you on the patient earlier? This is her, okay? And this is her after one 20-minute therapy. Just to let you see, this is the patient on the left before the care. This is the patient after one 20-minute therapy. So we know the therapy works. The question and the decision is, how much is it going to work for you? And here's the patient before. This is after first 20-minute therapy. We know this works. We know our therapy is effective in helping the nerves work better. And in a nationwide study, we found that 90% of our patients together were satisfied with their care in as little as 2 weeks. This is because our program is multi-pronged. There's coaching, there's nutrition, there's exercise, there's everything needed to make those nerves get better. So today we're going to perform our advanced neural foot analysis to check the function of all the nerves, the large, the small, and the microscopic. From there, we're going to score your severity. We're going to score your symptom severity, and we're going to score your nerve function severity to give us an approximate percent loss of your nerves. We will also observe the foot because these types of feet that are deformed or have these characteristics are connected with a genetic or hereditary form of neuropathy. So we will examine the foot and look at the foot for possible causes of this neuropathy. We're also going to examine your mouth and tongue, because people who have cracks or called fissures in their tongue also are connected with hereditary neuropathies. I'm going to introduce to you now the ProNeuro Home Neuropathy Management Program. This is an approach that allows us to have better results with our patients, because neuropathy is a progressive disease, and every day you're not doing something to help your nerves, there's a chance that they're losing. So the effects of our care is cumulative. Each visit is cumulative. So we're offering you a modern approach to neuropathy care. It's a do-it-yourself, at-home nerve rehab program. There's no need for driving long distance to the office in heavy traffic. You work every day, not when the doctor wants to work. You get better faster. You have unlimited care, more treatments. It's going to save you time and money. Because every day we have more success relieving neuropathy pain. Why not you? We have patients that have reduced pain and cramps, reduced tingling or numbness in their fingers, toes, and legs, ability to walk without pain, reduced feeling of cold and burning and pain in the feet and legs. They have improved sense of balance and coordination, less dependency on medications, improved sleep, and less restless leg. I thank you for your time. The Neuropathy Relief Center's objective is to repair, regrow, and regain.